In a deeply concerning development, new data reveals that deaths in Immigration and Customs Enforcement, or ICE, custody have hit an unprecedented high under the second Trump administration. This isn't just a slight increase. We're talking about a record number of lives lost within the detention system, sparking serious questions about conditions and oversight. According to ICE's acting director, Todd Lyons, a staggering 44 people have died in custody since he began his tenure in March of 2025. And a separate tally places that number even higher, at least 48 people, since President Donald Trump took office for his second term in January 2025. Lyons, who recently announced his intent to resign at the end of May, attributed this grim milestone to one primary factor: the sheer volume of detainees. He told lawmakers, "It is the highest because we do have the highest amount in detention that ICE has ever had since its inception in 2003. This aligns with the administration's stated promise to dramatically increase deportations from the United States." However, this explanation isn't satisfying everyone. During a House budget hearing, Representative Lauren Underwood of Illinois grilled Lyons, directly questioning ICE's practices and the Department of Homeland Security's approach. She powerfully pushed back on the idea that just having more detainees automatically explains the death rate, arguing, "You have more officers, you have more resources. That's not, in my opinion, a valid rationale why the death rate would be increasing." Underwood emphasized that neither Congress nor the public has received a clear, real explanation for this tragic surge in deaths. Adding to the concerns, it appears there are no specific policies in place to try and reduce these deaths. Lyons himself stated there is no such policy. And when it comes to transparency, things are becoming even more opaque. Recent reports indicate that ICE has limited disclosures on the circumstances of detainee deaths, seemingly changing a previous policy to notify the public and Congress within 2 days. Online postings about investigations have also been delayed. While a partial DHS shutdown was initially cited for slowing non-essential reporting, Lyons contradicted this, stating there was no legal basis to consider investigating deaths as anything but essential. Further compounding the issue, a newly published JAMA study offers a sobering perspective. It shows increasing rates of deaths in ICE custody, surpassing even those seen during the height of the COVID-19 pandemic. The latest fiscal year, specifically from October 2025 to January 2026, recorded the highest death rate in the 22-year study period. Researchers unaffiliated with the study concluded that these increases are less about isolated instances and more indicative of systemic weaknesses in medical care, mental health protection, and mortality review within the facilities. Currently, more than 60,300 people were reported to be in ICE detention as of early April, and looking ahead, ICE is actually requesting $5.4 billion from Congress for the 2027 fiscal year, a budget that includes funding for 41,500 detention beds and plans to expand detention facilities. The rising number of deaths in ICE custody paints a troubling picture, raising urgent questions about accountability, conditions, and the human cost of current immigration policies. As these numbers continue to climb, the call for greater transparency and reform grows louder. We'll continue to track this critical story and bring you the latest developments. Stay informed, and thank you for watching.